When you have a scheduled appointment time, many expect to be seen within 10 to 15 minutes before getting a little impatient, right? Imagine having to wait 20 minutes to an hour and a half after your scheduled appointment time, 3 days a week. Unfortunately, this is the reality many of our veterans face when coming to our dialysis clinic. As a veteran who has received care at the VA several times, I know firsthand how frustrating the waiting times can be. Finding an effective solution that will reduce waiting times and improve patient flow at the VA dialysis center is the main goal of this innovation project. The current process consists of all second shift patients having the same appointment time scheduled for 11 a.m. As they arrive, they must sign in on a clipboard and have a seat in the waiting room. This first-come, first-served method has led to the increase of patients competing to get to the dialysis clinic first, sometimes hours before the second shift nurses even arrive, just so their name will be the first to call when the next available chair is ready.
Good morning, Ms. Hill.
I've been waiting 40 minutes.
Did you sign the sign-in sheet?
I did.
Okay.
That's Miss Hill, H to the I to the double L. And I'm a veteran. I'm tired of this.
Well, the team leader's working on the schedule now. If you have a seat in the waiting area, she'll be right with you.
No, I'll sit at home.
Some patients shorten their treatment time or skip their treatment entirely due to the unpredictability of what time they will be dialyzed that day. To improve the patient flow process, appointment times must be staggered and depend solely on when the first shift chairs open up. Because first shifts have assigned chairs already, we can predict what time their chairs should be open based off their prescribed treatment time. Add an additional time for cleaning and machine setup, and you have a specific availability time for each chair on second shift. The next step is to strategically assign second shift patients to a specific chair and give them their new scheduled appointment time. By transposing the current paper assignment into an electronic-based system, this allows the use of technology to enhance the workflow process by saving time on repetitive tasks, reducing errors, and improving on communication. A system that provides the ability to link to a dashboard in the waiting room where patients can view in real time their assigned chair, their new appointment time, the assigned nurse, and whether their chair is ready yet. With the elimination of handwriting on paper and not having to assign each patient to a chair each morning as they become available, a substantial amount of time and steps have been reduced for the team leader. Patients are expected to arrive at their newly scheduled appointment time and be dialyzed in the same chair each treatment unless otherwise instructed. They will be permitted in the unit once their chair status says ready on the dashboard. Our planned outcomes include a reduction in patients shortening or skipping their treatments due to unpredictable wait times, less congestion and chaos in the unit during turnover, increased patient satisfaction by dramatically reducing wait times, an increased workflow process, and increased satisfaction for the team leader and the staff.